Hey, Dave Sullivan here again, and in this series, over the next 6 weeks, we're going to accomplish more than we have in the last 6 months in terms of career progression, patient results, and growing your confidence, but also your business in private practice. So, yeah, if you don't know me, I help private practice owners have the confidence to help any patient who comes through the door. We do that using a simple pro sport step-by-step system so that you can ultimately enjoy a fully booked diary of happy progressing patients. Okay, so in every single one of these episodes, I promise you I will deliver you one thing that you can implement in your clinical practice that's going to help you, your patients, and ultimately give you an edge over the competition in your town. Okay, so what we're going to talk about today is how to explain effectively to your patients the problem and the solution so that you ultimately get buy-in, adherence, and that they will stay on track all the way to the final sessions, because that's going to be a challenge that you will inevitably run into after 2 or 3 sessions when the pain eases. Okay, so here we have a simple stickman numbers. Okay, so again, anybody could draw this drawing that I'm about to show you. Okay, and why we explain to the patient the problem and the solution like this is because we want to come down to the patient's level. Okay, everybody understands stickman, everybody understands numbers. What we don't want to do is we don't want to pull the patient up to our level and explain in big fancy terminology. Okay, so that's the psychology behind this. We come down to the patient's level, we show them in stickman, and we show them in numbers. Here's the problem. So again, remember our question from the other day. Okay, so if you have a shoulder pain patient on the left, what isn't happening, that if it was happening, it would take the symptoms away. Okay, so if we get more load going through the biceps and the forearm, maybe this patient had, for example, a wrist injury or wrist fracture 2-3 years ago in their history. So if we get more load tolerance happening through the forearm, that will co-contract with the biceps at the elbow joint. That's going to take more load through the limb, which will stop the rotator cuff, the labrum, whatever it is, taking more load. Okay, so what isn't happening, that if it was happening, okay, it would take the symptoms away and it would pass the test of time. So then when this patient got back in the real world, once we address that problem, when they go to lift a kettle, when they step with an outreached hand or anything like that, we'd solve the problem once and for all. Okay, so this is how we'd actually explain it to the patient. Okay, here's where you are at the moment, and here's where we're going to get you to. Okay, so don't worry too much about the iceberg for now. Okay, so we go, right, this is the problem at the moment, so this is why I'm going to be doing a lot of rehab exercises on your forearm, blah blah blah, and then this is where we get you to. Okay, now there's a lot more psychology goes into it than just what I've given you, but I just want to give you the framework today, the overall view, and I want you to start thinking about how you can come down to your patient's level. Okay, because if we can explain this in simple terms to our patient, then they're going to have clarity on what's the actual problem and what's the actual plan. Okay, and if we have that, then we're absolutely flying. Okay, so that's the one thing I want you to implement today, okay, or tomorrow, is when you've done your assessment, I want you to bring the patient, I want you to come down to the patient's level, and I want you to explain the problem and the solution in a very simple way. Okay, now if you want a little extra help putting this strategy together, there's a little bit more psychology obviously and steps to go into it than just that, but if you want a bit more help while learning more strategies to ultimately help you become that calm, confident go-to physio, then the Pro Sports step-by-step system treatment plan, it will give you that confidence and certainty. Okay, that certainty to treat any patient who comes through the door, that certainty to keep them progressing all the way to the final sessions, so that ultimately you can get that recognition as that go-to therapist. Okay, it'll also show you how to design treatment plans that make a massive difference in your patients' lives, and it'll also give you the most simple and direct way to grow your career and also your clinic while giving your patients the best possible outcomes. Okay, so I've got 24 spaces in July in this cohort. If you want to be one of those people, if you're interested, if you want to know more information, drop me a message below and I'll give you all of the details. Okay, so for today, your action is after the assessment, I want you to go down to your patient's level and I want you to explain the problem and the solution in very simple terms. Okay, that's it.